Hi guys, this is Dr. Pascal with Spinal Health Distributors. Today we're going to be talking about the cervical Denneroll and how to use a cervical Denneroll. So we have three sizes to the cervical Denneroll. We have the small or the pediatric unit, which can also be used for older subjects or patients with very stiff, rigid necks. We have the medium unit, which was designed for someone that was 5'8" or less, or someone with a semi-flexible neck. And we have the large unit, which was designed for someone that is 5'9" or taller, or very flexible patients. The cervical Denneroll was designed for patients that have anterior head carriage, so when the head drives forward, right, less than 50 millimeters, which is about 2 inches. And when we take an X-ray, for patients that have a loss of the cervical curve. Research shows us that the cervical Denneroll is very effective in helping patients reduce that forward head posture, improve the neck curve, headaches, neck pain, and also improves cervicogenic dizziness. So the cervical Denneroll is used by the patient on the floor at home. Okay, we need a firm, rigid surface for the patient to be able to use the Denneroll. So there are three different neck placements. There's the low neck placement. It's very low in the neck, almost into the shoulders. There is a mid-neck placement, where the Denneroll is in the middle of the neck. And then there lastly is a high neck placement, where the Denneroll is sitting in the upper neck. Most commonly, the Denneroll is going to be positioned in the mid to low neck for most patients. Now we need an X-ray to determine exactly where that cervical Denneroll peak should be, based on where we see the most loss of curve on X-ray. If you're not a doctor that's using X-ray and you're using the Denneroll to correct forward head posture, we want that Denneroll fairly low down in the neck because we're using the external auditory meatus as our landmark, and we want to see that posterior to the AC joint. When the patient is done using the cervical Denneroll at home, we teach them to take the roll out of their neck and rest on the ground for a minute or two before coming up. The cervical Denneroll is changing the curve of the cervical spine and is quite aggressive. So if the patient sits up too quickly, they can be dizzy at times. So to avoid that, we simply have them rest for a minute or so before they come up. If the patient has any worsening of their symptoms, we tell them to stop using it and check in with you, the healthcare provider, right away. As well, if they're sore after using the cervical Denneroll, we recommend that they use ice to just calm down the inflammation or that temporary soreness.